A lot of people look at that number, 0.17. It is solid medical evidence to them. It's exact, especially in this CSI era where people think, oh, that's what just said, that's what it is. From a defense standpoint, how do you argue that?
Well, Christy, that's difficult because there's a preconceived notion in America that if it's a blood test, it's got to be accurate.
Right.
But just as in the case of, let's say, if you have a case that's pending against you, and you have a damning police report with some damning facts in it in the narrative that you think are clearly embellished and clearly false, you would look behind that police report, right? Mm-hmm. Well, that same thing holds true for a lab report. When you have a lab report, you don't just look at the result and say, oops, that's it, I'm over the limit. You look behind it to see if the laboratory that the police used, which, by the way, has police employees working in there for the government.
Sure.
You look behind it to see if they follow the proper protocols on the gas chromatography machine.
Okay, so it was interesting when you said you look behind it at, the police who are working on this. So,
yes.
So what are you intimating there?
Well, what I'm intimating is quite often you find there's different levels of laboratories with different levels of expertise. Let's say an EPA laboratory is a really high governmental type laboratory with exquisite procedures and exquisite training on the personnel there, such as in the case when they're testing lead in your backyard from a factory or something like that, or a contamination in a river. Those are really super high standards. But what you find often across America in a lot of these labs, especially the forensic ones that the police use, you just have button pushers who really don't know what they're doing, and they just push buttons, they inject something, and they do things, and sometimes they inadvertently, they don't follow the proper procedures, and mistakes are made.
What kind of mistakes can be made, though, if you're trying to determine, it's some people would look at it and say, yeah, but it's still, you're extracting blood, you're dissecting what is in it and the alcohol content. What mistakes can be made that would compromise how that test turns out?
The fact, I'm glad you said that, Christy, because the fact that you said you're extracting blood is kind of a fallacy. Yes, there's blood coming out of your arm, but the typical gas chromatograph uses headspace and flame ionization technology. Okay, I'm going to try to keep it simple here.
Thank you. So, you can see my face going, huh? Okay, go ahead.
So, they put the blood in a centrifuge. Usually they reduce it to a serum or a plasma.
Okay.
Because blood has lots of things in it that they don't need to test. It's dirty and there's lots of molecules in there.
Sure.
And the molecule in this particular situation that they're looking for in a DUI case is ethanol. Okay? That's what we call the target analyte. Okay? That's what we're looking for. And the purpose of a gas chromatograph, the first purpose is to separate everything else out. You have to, it has a chromatogram that has peaks on it, and you have to look at those peaks as a defense lawyer and analyze those to see if it really has what it says in there in that molecule. And there's different types of peaks. There's something called coelution. I'm going to keep this simple. Coelution is a faulty peak that has more than one type of molecule in it that the machine is falsely reading and saying is ethyl alcohol.
So how many different times will they test this in order to make sure they get it right? Do they test it 2 or 3 times and take the average, or is this just one test?
Well, normally what they do is on a gas chromatograph, there's like 2 different sections of it, and it does the test twice, and then it compares it. Okay? But if the same mistakes are being made twice, then the same faulty result is there. And if you're not identifying just ethanol, the molecule we're looking for, if you're confusing it with maybe methanol or isoprofitol or acetone, other common things that the machine has, it has a similar molecular structure and confuses with alcohol, then you have a big problem.
So you can have false positives, but can you have false negatives too?
Well, I suppose so. You certainly can. If they really mess it up, you can have a false anything. But what I like to say, as far as that preconceived notion that many people have or many jurors have, is at the end of the day, the state has a burden of proof. And if the state can't explain to the jury so they understand how that magic box works, the gas chromatograph, so they understand it well enough to explain it to somebody else, then if they can't do that, they should find the person not guilty, because we're not supposed to have blind faith on a machine that the government says this is it. You know?
Okay, let me ask you this. This is something we were talking about. We know that if you're at the scene and you get pulled over, you have the right to refuse a breathalyzer. Do you have the right to refuse getting blood drawn?
Well, listen, the government, it's called chemical testing, and the government has a right to ask for, usually in every jurisdiction, they can ask for breath, which they normally do because it's quick and easy, although not that accurate, blood, or urine. Now, urine is usually, they'll take a urine sample if they think you're smoking pot or doing drugs.
Okay.
Blood is usually for alcohol and sometimes drugs too, and breath is usually exclusively when the officer suspects that there's alcohol involved. So in most jurisdictions, you can refuse any one of those that they offer you.
Okay. So even 4 hours later, John Goodman could have said, no, I'm not taking this blood alcohol test.
He could have. However, in many jurisdictions, when there's a serious injury or
a fatality,
they can get a warrant and strap you down and take it.
Okay. All right. That's good to know.
Yeah.
Wanted to make sure that everybody knew their rights if they are ever a suspect. Thank you so much, George Stein. He's sticking with us, too. We have a lot more to talk with him about. This is day 12 of the John Goodman DUI manslaughter trial, and on the stand